All right, good morning, everybody. Welcome to the webinar. We would like to thank our sponsors for their generous support, and we would like to thank the providers who are on the front line serving those affected by COVID-19 right now. We invite the attendees to use the chat section to share what you're doing in your communities and any action items that you will do to advance the opioid use disorder efforts in your local community. This webinar is being recorded. We also invite you to ask questions during the webinar using the Q&A section at the bottom of the screen. In order to obtain CME through the American Academy of Family Practitioners, take note for the instructions at the bottom of the sponsorship slide here, and make sure that you email the rhau@suu.edu. All right, so I think those are all of our housekeeping things, and it's my pleasure to welcome everybody to the webinar today. My name is Dr. Ashley Yager. I work with the Health Extension Advocacy Research and Teaching Initiative at Utah State University Extension. I am the moderator for today's session, so I'll be chiming in and asking lots of questions and helping ask your questions of the panelists as well. I am the HEART team coordinator, and I am in Carbon and Emery counties, where I chair and founded a local coalition for opioids and substance use prevention as well. So welcome.
My name is Casey Shakespeare. I'm actually at the Southern Utah AHEC office, and I'm the program director for the Utah Rural Opioid Healthcare Consortium. Next slide, Ashley. So we serve Beaver, Carbon, Emery, Grand, and Iron County. So we're scattered in 2 regions in the state. And we have a number of consortium members. You can see them listed here. Ashley's one of our consortium members. And then you go to the next slide. And our program focuses on 3 areas: prevention, treatment, and recovery of SUD, OUD. So you can see here on the slides a few of the activities that we work with in our consortium. So.
Thanks. Thanks, Ashley. I'm Susie Prevedel. I am a co-investigator on our Tribal and Rural Opioid Initiative with Utah State University. It's a cooperative agreement between the USU Extension and the College of Education and Human Services. And so I'll just introduce a little bit of our team. Sandy Sulzer is our lead on this project, and she's our health and wellness specialist for the Extension. Our lead researcher, who's been doing opioid and substance use disorder research for a few years, is a partner who comes from the University of New Mexico, Aaron Madden. My role is I'm county faculty in Duchesne, Onondaga counties in northeastern Utah. And on the tribal side of our work, our tribal coordinator is Michelle Chapoose. Slide. So this is a little bit, this is our information that we have, a few of the activities that we're involved in: rural community outreach and our Tribal Opioid Resource Center, which is located here in our Roosevelt Extension office. And we'll talk about this one a little bit as we go, but one of the big events we have coming up this year is our 2020 Intertribal Opioid Wellness Summit. Thanks, Ashley.
And I am Dr. Maren Wright-Voss. I am part of Utah State University Extension's HEART initiative, which is, as Ashley mentioned, the Health, Education, Advocacy, and Research. Oh, I'm forgetting the T. Ashley, help me with the T. Teaching initiative. Thank you. So we serve 9 counties in Utah, and the counties I work in and serve in are Twila County and Salt Lake County. The HEART group was put together as a way to bring some of the resources of the land-grant university, Utah State University, out into the communities to address a current crisis in the opioid epidemic. And so it focuses on several of these high-need counties that are highlighted on this map where opioid overdose rates were particularly high. And so I'm a member of that team working on that initiative. Go ahead and do next slide. And Twila County is an area where we were able to obtain Health Services, HRSA, Health Resources and Services Administration grant to be able to take a coalition approach to trying to address the opioid epidemic. And so I have on this slide several of the partners that we've been working with in Tooele County. We have the local hospital, Mountain West Medical Center. Valley Behavioral Health is our local mental health authority. We have the school districts, we have Boys and Girls Clubs, the local health department, as well as Tooele has been sort of at the forefront in putting together community coalitions. They've had a Tooele City Communities That Care organization for over 12 years and have done a really good job of bringing in a community approach to trying to address some of these bigger issue things that impact our community. And so, and then I also work with the Tribal and Rural Opioid Initiative that Susie is a part of, more of a state level. And so I'm the lead on that HRSA grant in using this consortium coalition approach to try to address the opioid epidemic. Thank you.
Great, so those are just our introductions, and I have a few general things that we'll talk about that I'll lead the group through. You guys can just take turns answering them. And then we'll open it up for some questions. Our contact information is on the slides if you have further questions about anything that we've talked about or want to get involved. And one thing that we want to know is what you're going to do in your community. A big part of our webinar today is to hear some ideas that you have as well. So let's go ahead and kick that off. So with your grants and initiatives, and thank you for those quick summaries, you guys, are there any lessons learned from engaging community leaders to collaboratively address this issue in Utah? Things that you've learned so far that you could share?
I can start with that. One of the things that I've learned through this process, and we are working with a couple of different federal funding sources, as the process itself has really helped me engage with people across the state at all different levels and figuring out who's involved, and that has really helped in being to move some of this work forward. Ashley, working with your team and also with Marin. And so I'll just do that comment that it's been really a good thing to learn that so many people are dedicated at all the levels, and being able to make that kind of statewide ability to reach out to people for assistance in our local areas.
And I'll comment next. With the HRSA grant, it's the same one that Casey's working with in Southern Utah, but it's asked us to coordinate prevention, treatment, and recovery services, and to sort of really address a broad, like the whole spectrum of the opioid issue, and bring all of the groups that are working on all of those pieces together in a consortium approach. And in doing that, taking the initiative on that in Tooele County, you know, we talked to the hospital that has its own domain and how it helps address the opioid epidemic. The mental health center authority has its own domain and how it addresses it. The courts have their own domain. And yet there were so many ways in which those groups weren't working together. And so really to be the point person and start to, I've just found out all the different things all of these key players have been doing. And it's really interesting how quickly we can sort of synergize our efforts as we start to come together on some of those. And so that's been a really nice sort of lesson learned and a big opportunity to take this federal funding and to be able to find out that there were all of these little, like, I guess silos is a term people like to use, right? They're working in their own silos. And yet there's so many ways we can help and support each other and have a bigger effect when we're working together.
And I'll second what Marin was saying. One of the first things that we came across when we formed our consortium 2 years ago was some of the consortium members weren't even aware of what other consortium members that reside in their communities had to offer as far as resources. So it's definitely been a learning experience that it's helpful to be able to come together as a group and pull those resources, but it's also necessary, especially with something like the opioid epidemic, where there's so many people that are working on it, so much funding available. that if we're not able to work together as a team, we won't be able to get the maximum impact.
I agree, and that's one of our benefits of having this great panel today to talk about some of the things that we're doing and different opportunities for that collaboration and working together. So in your mind, what are some opportunities for collaboration or opportunities that people can do in their local communities?
As I mentioned, in Tooele County, it's been sort of at the forefront of having these community coalitions. It started some of those earlier than some of the other communities in Utah. And it's not hard to join the community coalition. So they usually hold their meetings in the evenings when it's accessible to community members. There's usually key stakeholders from several different agencies that are involved in a community response. That's a lot of these community coalitions are focused on prevention in general, so it doesn't have to be substance use disorder specific. It can be addressing some of the other, like reducing youth, juvenile delinquency and stuff like that. So finding out where that coalition is in your community, and if there isn't one, like Ashley started the coalition that was needed in Price, maybe asking, one of us, anyone at your health department, say, how can I get one of these coalitions started? Because it's an easy way to get involved, and you just find out all the opportunities that there are to have a positive impact on your community. So that's one thing people can do.
I think, in my opinion, one of the things we can do is just in our own agencies and other places as well, is just to be more outward looking. And by that meaning, if we're working on a specific project or an idea, to be able to just say, reach out to our community partners who are all working in the same public health arena and say, hey, what have you got going on? Just to make sure that we don't duplicate and invite everybody in to participate in different things that we're having. And that helps form the relationships to then build the coalitions or consortiums down the road.
I agree. And there's a lot of information out there about how to start and do an effective evidence-based coalition, starting with SAMHSA's Strategic Prevention Framework and all these different great references like CADCA has to offer. They're at the national level. And if you want to see Utah coalitions for prevention, you can look up the utahprevention.org website, and they have a list of prevention coalitions in different communities across the state.
As you're mentioning those great opportunities, just think about some of the things I've seen our coalitions doing. There's the drug take back events that they support, but also little things like our coalition decided that in order to increase community sort of connectedness in our youth, they had the mayor start doing a formal recognition of one student a month. And so the person gets invited to the county hall and gets to have that, like it just makes the mayor feel like they're involved and that they care about the youth in our community. So there's just simple little things that can be done that build our communities up, and just so many ways to get involved.
And if you're struggling to find stuff within your own community, outreaching to some of the state organizations, other consortiums in counties can be a great place to start to see what they know of what's happening in your community and what's happening in other communities that you might be able to mimic or to implement in your own area.
Yeah, a good contact for that is also the Utah Coalition for Opioid Overdose Prevention. That's statewide, so thanks, Casey, for bringing them in as well. Are there any successes or early wins that you guys have seen in your areas or programming?
One thing that's coming out of our Tooele consortium, we haven't had a methadone treatment center option in Tooele, and it wasn't even really on the radar screen of anyone who was dealing with the opioid epidemic, even though we know it's a best practice. And there are many people who have opioid use disorder who will respond to methadone treatment, and that will manage their disorder, whereas some of the other medication options won't. And so it's a really good thing to have in a community. And it wasn't even on the radar screen, but just through our groups coming together, the hospital, the mental health authority, a local clinic that's been doing some substance use disorder treatment, we started to be able to figure out how to make it happen in our community. And it hasn't quite happened yet, but we're now on that path to getting a methadone clinic in Tooele that I don't think would have happened without this consortium approach and all the minds and people working together, sort of brainstorming how can we make this a reality for Tooele.
With our consortium, I think one of the major successes we've had is we organized two community coalition or community summits last summer. And then we helped support a third one that Ashley put together in Carbon County. And just to see the outpour of support, not only from the healthcare community, but also from the community members, and to see how motivated people are to work on this issue, really gave us some energy in our consortiums to know that people are behind us and working with us.
I'll talk about our Tribal and Rural Opioid Initiative project a little bit. We have several different things that are, I would consider successes or early wins. And one of our first big outreach events was our Rural Opioid Health and Wellness Summit in Carbon County last year in Price. And I felt that we had a really nice representation from our recovery community, and people were able to really share their stories with that. And part of our role with our education efforts are to destigmatize the treatments available for people in our recovery community. And that was really a statewide effort between all of our rural partners and the HEART team and many folks who attended and our community members. And I really appreciated the input for that. One of the other early successes that we've had, I feel like, are our community naloxone trainings that we're doing. We do quite a bit of just education on opioids and substances in general, and then more specifically on naloxone as a harm reduction process and how to save lives with that in the communities. And so the HEART team and our tribal coordinator, Michelle Chapuz, they have co-presented in many small communities and at different groups around with that. And I'll talk about our tribal work in a second. And then one part of with that is we were able to go to a farm field days and adapt our curriculum down to really kind of a rural education component, what to do in an emergency. This is just one other kind of emergency that youth might see in their home. And so we spent some time talking to, down in San Juan County, to the school age kids, everybody from preschool up to about 8th grade, and had a great time in that format and learned some things, and were able to talk about naloxone and maybe what painkillers and an overdose poisoning looks like. One of our other successes that I'd like to throw out there, and you are welcome to look for our contact information, is the Master Health Volunteer Program. It's online, and Maren can speak to that one a little bit if she wants to, in a little more detail. And then our tribal work, we are really excited that we've been working across the state with some of our different tribal populations, and have received MOUs, memorandums of understanding, from the different tribal entities so that we can go in and provide that education to their community members in their settings. So, and I welcome questions on that if anybody has specific questions, or I know we're going to do those at the end. Is that going to happen in our Q&A format, Ashley? Good.
Yeah.
Okay, thank you.
Wonderful. I think everybody touched on early successes being connecting to people and local communities. And I just want to echo that too for some of my local work and work across the state with different organizations that we're involved in. I think it just really, a lot of it comes down to collaborating and working together, because you can do so much more together than you can on your own. And so it's reaching out and getting connected And that can make a big, big difference in local communities. I think that's a lot of our early successes and wins is partnerships and being connected. So what are the gaps and opportunities that are still remaining that you see? And maybe I'll go first and inspire some things to pop up in your heads. Some gaps that I continue to see are long-term funding for different things. I know we have a lot of shorter-term funding, but I think some gaps are some more sustainable types of funding things for different initiatives or medication-assisted treatment centers that are on grants and that type of thing. So I think that's one thing that is an opportunity that we have to continue advocating for those centers and different ways to treat mental health and opioid use disorder.
Mm-hmm. I think another gap is still the stigma that exists, not only among community members, but among healthcare professionals about treating OUD. It prevents progress in getting more providers MAT certified so that they can treat patients. It prevents patients from coming in and using resources. So it kind of negatively impacts, in a way, everything that we do. But it's also an opportunity to educate more people in that OUD is not a behavioral issue. It's a physiological disorder. Get more people to be more open to the idea of seeking treatment or giving treatment, and that'll help expand the reach of everything that we're doing.
And I'll just build off of what Casey just said. We both got to go to a national conference because of this federal HRSA grant that we participate in. And there was an example, I think it was from the state of Vermont, of some really intensive work they did. They're a small state, so they were working on a small scale, but they were able to get almost, like almost every primary care practice having a waivered provider, and really bring the treatment of opioid use disorder when it's at a more mild level into the primary care setting. And in doing that, they just had amazing success with reducing like the higher level care that's needed through rehabilitation treatment and those sort of inpatient options, because they were treating it early. And there was less stigma around it because it was just there in the primary care doctor's practice. So those sorts of opportunities exist, and we can learn from a national level and bring that into our local communities, which is a nice opportunity.
I would agree with that also, Maren and Casey. And then one thing that I would see too as an opportunity is really that political will for our communities to really, as you said, work through the stigma issues with this and make this a medical condition that can just be addressed and be worked on more openly. And then within that, creating kind of these community surround settings and more people working out on the front lines to help that surround care in nutritional aspects and job seeking and some different things to help people really get integrated and be able to meet their basic needs so that they can work and continue the recovery and stay really part of their communities wherever they are.
And then I'll mention one more opportunity. So we have drug courts in most of our rural counties, but mental health courts haven't necessarily been something that's been across the state of Utah. There's definitely one in Salt Lake, and I'm not sure which other counties have that. But just the opportunity for more integration between substance use disorder treatment and mental health treatment, and the way that then impacts people through the criminal justice system. I think that's a big opportunity for us to really address the issue comprehensively in a way that's going to reduce the impact.
Yeah, a lot of opportunity to advocate for mental health parity and treating our mental health the same way that we treat our physical health and reducing that stigma. So I think those are some great points. Are there any action items or things that people can do moving forward, important relationships, important collaborations, important opportunities that you want to speak on or touch on? And I have one that I know CoMagin Health is doing a lot of opioid work throughout the state, and they're providing training and talking a lot about MAT, and they have Project Echoes for education for providers. And I know they're rolling that out in the next couple of months. So they are a great contact of something that could be a good opportunity moving forward if you wanted to know more. So that's one opportunity that I can think of, contacting Ryan Brown, rbrown at comagin.org. Thanks for sharing that.
Another opportunity, if providers are looking to get involved in MAT, Connie Kitchens at the University of Utah, she's part of the program of addiction recovery, clinical care, knowledge, and advocacy. I believe it's PARCA. They work together with a few partners at the University of Utah, including our UROC medical director, one of them, Dr. Beth Howell, to offer those MAT trainings. And with the current COVID-19 situation, they are looking at trying to get that initial in-person part to where they can offer that online. So for more information on that, they can reach out to Connie Kitchens at hsc.utah.edu and get on the list for when they get some more of those trainings rescheduled to be able to get in and get certified for MAT.
I'm thinking that a nice step for a community member to get involved is in the recovery days that are held in September. Most counties have some sort of celebration, and in Tooele, they've focused on it being about being a recovery ready community. So it's not just an event for individuals in recovery, but it's really an event for the whole community to say, you know, we're going to reduce the stigma, support people, but also work on prevention so that this is a community that's a safe place that we can reduce the impacts of substance use disorders among our community members. So like I said, most counties have those. There's, if you just Google Recovery Day Utah, you'll find a statewide website where you can find out if there's one in your community. And it's a really easy way to get involved and meet the people that are already doing this work and care passionately about it and be part of that community.
Just following up for community members, it's important to understand and practice proper disposal of your medications and to share that with family members, making sure that just eliminates opportunities for people to abuse those medications when they're not around. So taking part in that, you may not ever have a problem with that, but a family member or friend could. And so making sure you don't have those medications lying around is something that everybody can do.
Casey, I was just looking at a research article from an analysis in Utah of opioid overdose deaths in 2008 and 2009. And it pointed out that only 15% of the individuals who overdosed in those years, there were like 260 that they evaluated, had gotten their overdose, you know, the drug they used for overdose off the streets or from an illicit drug supplier. The rest had come from family members, prescriptions, from doctors. So that's a very good point. Safe disposals, really important.
Just being a proponent or an advocate in your own family and friend groups, you know, it's kind of that culture in Utah. I mean, we're seeing it with groceries and toilet paper right now. You save what you can for a rainy day. And oftentimes that's what happens with leftover pain prescriptions after you have a surgeries. You save them in case something happens. Maybe I'll roll my ankle and I need that, you know, that lower tab to get through that. But that's just playing with fire to keep those things around. For your sake and for the sake of those around you, they need to be disposed of properly.
I agree. I think our prevention folks are doing some great outreach, and also at all the levels, local and state, with the prevention. And I would just like to remind community members what they can do as well as just see people as people first, and be careful of the language we're using to address people and really start, I invite people to go online and look at recovery stories and look at people, and there are incredible people in our lifelong recovery from many different substances or opioid use disorder, and really be supportive of people in their whole journey with this. And so I think that's a really big part of reducing the stigma, is recognizing these are us, these are our people, our neighbors, our friends, our community, and providing that gentle outreach right now as everybody's going through a lot of stressors. I did see a note come up on COVID that we'll talk, but that's just a reminder of action, things that we can do. And yeah, please do reach out and look at where we can support our different recovery communities throughout the state, from that very low case community, or kind of the grassroots community level, and then also look to our county leadership and our health and local agencies, and figure out what support we can give them as well.
Thank you, Susie and Marin and Casey. Those were really great. I echo everything that you said on those. We have a few questions, and if people want to ask questions, I'm going to remind you to use the question and answer button as well at the bottom of your screen. And so far, we've had a couple questions. One is, what can I do to reduce stigma? And I think we've touched a little bit on that by treating people first as people. And I think another big thing is changing language. And there's a lot of different guides out there. We probably all have individual guides on how to change language and using person first language. But I know one place to look is our HEART website. I think there's a couple others. Casey and Susie and Marin, you might know a couple other websites to direct people to, or other things as well.
One of the other things I was thinking of in reducing stigma is that, you know, it's not just how we talk about other people who have opioid use disorder, because so many of us have been impacted, even if it's indirectly, through someone we know who's struggled with it. And I think just being willing to not hide it and to talk about it. One of my community members that I work with has shared part of why they're passionate about it is because of a family member who's been impacted. And I interviewed somebody for a job position, and they shared that that's part of why they're interested, is because they've been impacted personally by through a family member. And it's just, so many of us have those stories that where we're personally impacted, and I don't know if that's something that we need to keep to those little private communications. That's something that we can share openly, and then we all just have this sense of community, that it's all around us, and it's our neighbors and our friends, and when it's talked about, then it's not something to be hidden, and it's not shameful.
Great. We have another question, and everybody on the webinar right now, feel free to chime in about what you're doing in your communities around this topic and what commitments you're going to make. Even if you aren't typing them into chat with somebody around you, or jot down a note about what you're going to do in your local communities. Our next question is about COVID-19 and that current situation and how that's impacting opioid use disorder and opioid misuse across the state. Maybe some rates are going up. What do you guys think about that situation that we're in right now? And what can we do?
I haven't seen any hard numbers yet to know if rates are being impacted. Maybe someone else has that information. I do know that USARA, which is a support and advocacy group for people in recovery, has been providing some of their recovery group resources virtually and online, because there is this concern that this is a vulnerable population when you're struggling with opioid use disorder. And so to then be cut off from your resources, that's just a big challenge. And then, of course, most of our treatment centers have gone to telehealth and trying to manage, still providing the resources under these social distancing restrictions. But I think it's a time when people are vulnerable, and as a community, we need to be a little bit more aware and a little bit more supportive right now to our people in recovery.
I think just to echo what Maren said with the USARA resources, if you Google USARA, USARA online resources, they have lots of multiple pathways to recovery resources on there that are not just USARA based, but they have lots of online things that you can advocate for as well. So thanks for bringing that up, Maren.
Thanks. Yeah, I know it's been on all of our radar and how it's affecting our contact with our community partners and different things as well. And one thing we're really doing is we do have naloxone available, and Michelle Chapus is our tribal coordinator and can do a naloxone training for anybody who needs one. I would invite you to contact myself or her. And we've just been reaching out through social media and just with some comments saying, hey, you know, we know times are rough and things. If a loved one or somebody you know, if you're concerned about them or if you need access to naloxone, please let us know. And I think it's good to point out at this time that many people have naloxone available, everybody from our community libraries to our local police and legal partners, and there's a lot of naloxone in the communities, and also it's available from your local pharmacy just by a walk-up or a call-in prescription to do that as well. And so I just invite people to please reach out to people you know and keep everybody safe during these trying times of COVID-19. We all know it's a highly stressful, and it's you know, people of our generation have not ever seen anything like this, really. I'm reading some of the historical accounts that have gone through, but the advantage we have is the ability to communicate across many platforms, video platforms as well. So stay connected and get people to the resources that they need.
You know, Susie, as you're talking about that, it occurred to me we need to do a naloxone training virtually, and then we can make sure each person who attends has access to naloxone in their community. We track down where they can get it. But one of the advantages of that is not just providing the naloxone information, but again, raising awareness that this is a time when people are vulnerable, and it's a time we need to be paying attention and making sure that we're supporting people in recovery and have the naloxone that's necessary to save lives.
And I think the whole situation's just forced us to try to convert as many resources as we can to teletype communications and electronic resources. And it's something we've been talking about with our consortium, but I mean, there's slow lead time to be able to prep all of these things, but I think we've done a good job of converting a few of our resources online, and we'll continue to do that until things open back up.
Yeah, we do have some things online. We have a substance use disorder counselor training, which is available on the KHS health site, and then also the Master Health Volunteer Program. And that's a good way if people have time at home and want to learn about different ways that they can become engaged in any facet of kind of community health and wellness in their communities, that's something that's already available from Utah State.
Thank you, Susie. That's a good reminder for me to remind everybody that there's an extension in every county in Utah, except for one. We share a county at one. And Master Health Volunteer Program through Utah State Extension is a great opportunity. So you get the training and then you can volunteer some hours. Our next question is asking if we've seen or think that there has been a paradigm shift of changing at the state level, that the opioid problem is a medical disease rather than criminal or legal based. And that may help the perception of the opioid crisis that we're facing right now. And any comments that you guys have on that?
I think that paradigm shift is part of why we saw this huge influx of funding to deal with opioid use disorder, just because at a national level, there was a realization that this is impacting everybody at every level. And so it was easier to see that there was this imperative, this as a society, we needed to support people because they weren't really personally responsible for the struggles they were having. And so they needed more support. But I definitely think that's filtered down. there's so much more support for alternative probation programs and for drug courts. And like I said, I think we're starting to see more of a push toward having mental health courts as well, where it's not dealt with as a legal issue, but you know, a more of a medical one, and one that we need to work together in order to resolve, not just blame the individual. So I think, yes, that paradigm shift is happening.
Yeah, I agree. It's happening. It's not happened. There's still those that hold on to the old stigmas that it's a personal weakness and not a disease. But we've seen within some of the counties that we serve in changes in the approach of some of the law enforcement organizations, that they're understanding more that this is a disease that people are struggling with, and instead of taking a punitive approach, trying to be supportive in any way they can. And that's, I mean, we're not there in a total shift to go from punitive to supportive and trying to overcome a disease. So still a lot of progress to make in that area.
I think so. That's one of the things that I learned last year sitting in with some of the panels from our justice system and our local law enforcement, that we're all in this together trying to get the best outcomes for everybody we can and keep everybody safe and protected. And I felt that we have opening these communication channels has given us a lot more common ground to be able to work out the best possible scenarios for everybody who's involved, to keep the public safe and to keep people who are in recovery or in addiction, keep them safe as well.
Mm-hmm.
You all sort of mentioned this, but who are the important players to get at the table to start making these changes in our communities, from stigma to changing these perceptions and getting our law enforcement involved and our key stakeholders and mental health workers? Who are some key people that we need to talk to get started, or continue efforts, I should say?
I think that could vary from community to community, but it seems like the places where we've seen the most progress is when we get just a well-respected community member, regardless of their position, that comes on board and starts that conversation. And we've seen that happen in a few of our communities where it's brought law enforcement, different parties to the table, but it seems like it's different individuals in each county, and it really each county has its own kind of unique personality. So you just have to find who are those handful of individuals in the county with the most influence that can bring people to the table.
One thing I've noticed is how much easier it is for a person to be influenced by someone who they have more in common with. And so I've noticed at some of the state summits we've had that when a person from law enforcement has had experiences where they recognize the value of alternative probation, then that's easier for other law enforcement individuals to hear and learn from, because they share experience with that individual. And so it's more relatable, and they're like, okay, this person is actually understands the conditions we're facing, and they've had the experience that tells me that I can trust what they're sharing with me. And the same for governmental officials, that when there's somebody else in politics or in government sharing, these are the policies that work and make a difference in the county, and you won't get sued over them, and that kind of thing. So then they can hear that message. So I think it's important to share that information across our county boundaries, and to hear from some of the people that have started to understand have had that paradigm shift themselves. And then they need to take that message out to others like them. So doctors need to talk to doctors, law enforcement individuals talking to law enforcement individuals, judges to judges, so that we can really get that understanding spread.
That's where the power of the coalitions come into play, when you can find people that belong to all of those different groups that can come together and be the voice for their particular segment.
I agree. Local coalitions can make such a big change and have so much impact, because you bring all those champions to the table, and the people that are important to have at the table. And I think not forgetting people who are in recovery either, because they have such good information and good insights to share. And I know there are not recovery centers in every county across Utah, but USARA serves Utah. And we're fortunate that we have a new recovery center here in Carbon County, and it's been really, really helpful for people. So that's been great.
One of the initiatives I've been working on quite a bit, and it's part of our HRSA funding in Tooele, is to build the peer support workforce. And I think the motto that I've heard at the state level is nothing about us without us. And so there's really a lot of good evidence that shows that peers having lived through some of those experiences are highly beneficial in the treatment and recovery process. But we need to get our peer workforce from just like serving as sort of a coach to being fully integrated in interdisciplinary treatment teams, because we can trust their expertise, and they need to be treated like the professionals that they are. And so then that then becomes just a part of the recovery community, and we all benefit through that.
Yeah, I would chime in on this, on the community coalitions a little bit, that sometimes it's surprising where the most support comes from. And so it's just really important to keep building relationships and reaching out to people across multiple projects. We know the opioid use disorder and now COVID are really like hot button topics, but also in community, things come in waves and come and go. So it's just really important to keep those relationships and keep reaching out to people in new positions as things change, and to make a really broad outreach to find out who the key players are within our medical system and within law enforcement and within our local decision-making groups, and figuring out where that common ground is going to be. I think everybody can agree that everybody wants a really healthy, happy community with healthy, happy community members in it, so that everybody's living a full life. And that's our goal. And so this is just an ongoing outreach effort, and the topics may change from time to time, but I think that's really an important thing to figure out where we fit into the whole picture with these initiatives that we're working on, and keep that real community focus, and knowing, just like Casey and Maren have said, that it looks different in each community, as we can attest, as we're all spread out across the state on this panel.
I think we have just a few minutes for final thoughts. If there's anything else that you guys want to say, Susie, I think you hit it right on the head, is that we want happy, healthy communities, and that's why we all do the work that we do. And we have to extend that beyond just hot topics and have some lasting change. But are there any other things, Casey, Maren, or Susie, that you want to leave people with today?
I just want to add to that hot topics. I know as we've gone to some of the statewide summits that, and when we talk specifically about opioid use disorder, people are like, well, you can't forget all of the others who are also struggling with substance use issues. And I, even if I'm talking about, or I'm getting a grant specifically for opioid use disorder, I don't see that as in any way exclusionary, because the coalitions we're forming, the connections we're making, the recovery days that we're supporting, that applies to everyone. And anything we do that's related to prevention in our communities touches on all of the different types of issues that happen in our communities. And I think I've heard prevention people say prevention is prevention is prevention. It doesn't matter. We're not, when we prevent substance use disorder, we're also preventing child abuse and that sort of thing. So, so I feel like this work we're doing does touch on all of those areas and makes our communities better, even if the label, the words we're using are opioid use disorder, we're working in the prevention space.
I'll just add, it's the puzzle we're still trying to solve on how to really resolve these issues, and whether we can ever completely eliminate substance use disorder or opioid use disorder, probably not, but just it's important to understand that even though it's kind of a slow moving process, you are making an impact. So If you're working in these areas and getting frustrated, keep working, keep pushing. We are making an impact. We are moving the needle, even if it's kind of slow. And especially with the COVID-19 issues right now and the shutdowns and the feeling like we're going to take a step backwards in our progress. I just want to reiterate and share, just don't give up on the issues that we're fighting through. Because even though the progress does seem slow at times, we are making a difference.
Wonderful. Thank you all. Prevention is great. Treatment works and recovery is possible. I think all those things are wonderful. So just thank you all for attending today. We just want to express our gratitude for having the opportunity to share some of these lessons learned that we have learned in Utah, and hope that this has been valuable use of your time, and appreciate all of our panelists and attendees, and feel free to type in the chat anything that you have that you want to do, but please share this information and continue the great efforts that you're doing. Thanks, everyone.